More and more of you are not retiring at 65. Is it because you do not want to retire? I think everybody wants to retire. There are people that like their job, but more and more people feel like they're forced to keep working past 65. And a lot of times that's because they have a younger spouse that they're afraid to put on Obamacare because of the price. And they're not really sure about themselves. Should they stay on their group insurance or should they go on Medicare? Let's talk about it because this is a question more and more people are having. They're working past 65 and they're saying, you know what? I'm going to stay on my employer group health plan. And they assume, since their employer pays part of their health insurance, that it's better than Medicare. They don't even check. They assume it's cheaper. They assume it's better benefits. They don't even check. And I would say 15 years ago, that was the truth. You didn't have to check. Your insurance through work would have been better than Medicare. Not anymore. Now I'd say it's about 50-50 that I see. 50% of the time, stay where you are. 50%, you can keep working, but get off your group health insurance. Get on Medicare because it's better in price and in benefits. You have to do the math. So you all ask me, well, what should I do? I don't know how much you're paying to stay on your group health plan. You got to go check it out, figure it out. What is your deductible on your group health plan? What are your copays? And then is there anything sexy and extra? Do they have dental, vision, hearing, anything extra? Those extras have really been scaled down over the last 15 years, but you might have a great employer with great coverage. You won't know until you do the math and you compare that with Medicare. You can call us. We can tell you how much Medicare will cost, your Part B, whether you want to supplement in a drug plan or you want to go private in Medicare Advantage. We can quote that for you in your zip code, but you got to do the math. You got to come to us with your numbers for your work insurance. Now, think about your work insurance. Your work insurance has limitations. So Medicare, you can go anywhere, but your work insurance has a network. You're used to it. That's not really a big problem. The deductible is often substantial with your work insurance. $1,000, $2,000, $3,000, $5,000, very common. So you've just gone along on this train for years. You don't realize if you had a Medicare Supplement Plan G, your deductible would be under $300 versus your work insurance, which might be $5,000. So don't assume that you should stay on that plan. Do the comparison. You also could have co-insurance, which is another whole thing out of pocket on your side. Now, one pill, one medication that you're on throws everything I said out the window. So you've done the math and you realize that it's better to go on Medicare. But you have one medication. A lot of times, and I can say this generalization, a lot of times your drug insurance on your employer plan is better than Medicare Part D. Medicare Part D is not so great. You're going to find that out eventually. So I'm giving a surprise away that typically your drug benefit through your employer is better. So do not switch strictly because your deductible is lower, your copays are lower, the co-insurance is lower because you did the math and you're like, I'm definitely going to Medicare. Don't do that until you also compare your drug prices, because what I see is if you're on one very expensive drug for rheumatoid arthritis, or you're on one expensive cancer drug, you're on one expensive, it could just be Eliquis, just a blood thinner, and it could be dirt cheap on your employer plan and cost you $70 or $90 or more a month on Medicare Part D. And just because of that one drug, God help you that it's not 2 or 3 drugs, we're going to keep you on your employer plan. Okay? Medicare Part D typically is not as good as what you're getting at work. Nobody talks about it, but that's my impression. Now, you are watching this at any time of the year and you're like, okay, I just did the math and now I want off my group plan. Some states allow you to get off at any time. So you can just call us, take me off my group plan, move me to Medicare, start saving me money, bing, bang, boom. But most states you can't do that unless you have a special exception. So if you have a special exception, you just got married, you just got divorced, you just had a baby or adopted a baby, your spouse got a new job, your spouse's coverage has changed, it's your spouse's work enrollment, you just became eligible for Medicare and Medicaid. So there are these 10 rules that if you do have those exceptions, you can change your insurance to Medicare at any time. But some people can't. They don't have an exception and they live in these states. The white states. The white states, if you're in a white state here, you can't change if you don't have an exception. Now, if you're in a green state, the green states are the good states. They allow you to voluntarily, at any time of year, go to your employer and say, hey, I'm out of here. Your benefits are too expensive and they're not as good as Medicare. I'm out. So if you're in a green state, you can do it right now. You can go do the math and decide you want to switch to Medicare. But do the drug price check first. Now, once you've done all this work and you've decided, you know what, based on that one drug for me, I'm going to stay on my employer plan, you get to do it every year. Because your employer will renew with their carrier every year and the prices will change and they will go up and your benefits typically will go down. So every year you have to do this math again. So if this year you decide I'm going to stay with my employer, next year, just because they changed it a little bit, you might be more beneficial to move to Medicare. So yeah, I know you didn't want to hear that, but you're going to have to redo your math assessment every year. If you have more questions, call our team at the Medicare Family. We're licensed in all 50 states. We would love to help you with your Medicare questions. Just untangle your situation, call for a free consultation, or if you actually want us to help you move from your group plan into Medicare, we can help you with that. You don't pay for our services. We're licensed wherever you live. Give us a call. Go to our website. You can book your own free appointment right now. If you like this video, you might really like this video. Check it out. And we'd appreciate if you subscribe to our channel so you never miss a great video. We put out one every week. Check in the description below this video for a link to our cheat sheet on Social Security and Medicare. And you can also give us a comment. If you have a specific question, always feel free to call us or email us at the Medicare Family.